Hello, colleagues. Thank you very much for inviting me to speak at the Digital Health Forum. I would have loved to be with you physically, not only for the purpose of this presentation, but really to engage with you. It would have been my first time at the conference of digital health experts. But really grateful for this invitation as we face some incredible challenges in our world together. And while I'm going to speak to you a little bit about the hub, the new WHO hub for pandemic and epidemic intelligence, I really wanted to start from my previous role and what has taken me to this role I've just started in. You know, I was appointed DG of the Nigeria Center for Disease Control in 2016. And in 2017, we had an incredibly busy year. Firstly, we had the biggest outbreak of meningitis that we've had for many, many years. It was a new serogroup C, relatively new in our context, and we managed that through the first 3 months of the year, realized and learned a lot of lessons on the time it took from detection to confirmation and to the response. And we actually quantified the number of deaths that we could have averted ourselves if that detection process had happened earlier. And we made that public in a publication and convinced in ourselves that we needed to reduce that time moving forward. But two other events happened that same year. We found the first case of yellow fever in Nigeria for 17 years, the first confirmed case. And then we found the first case of monkeypox, a disease that hadn't been confirmed in Nigeria for 40 years. Now, could it really be that these are completely new diseases that were emerging out of the ecosystem in Nigeria? Well, yes, it could be, but we didn't think it was the most likely explanation. What was happening is that as we improved our systems to detect, our surveillance systems, our awareness among our clinicians on the prevalence of these diseases in our context, in our lab infrastructure, we were then able to confirm diseases that we think were circulating in the ecosystem for many years. What led to that improvement? We invested in our surveillance systems, slowly training people, defining case definitions, taking it across the health worker landscape, providing new digital infrastructure through a new surveillance system called SORMAS, moving our disease reporting from paper to Excel to this digital platform. We set up our new national reference lab the first test was done during the meningitis outbreak in January of 2017. And from there, we continued to build up what today is a huge complex of complex laboratory diagnostics happening every day in Abuja, in Nigeria. In addition, we set up an event-based surveillance system using a locally developed software we call Tatafo, which is the word for gossip in a local Nigerian language, and generally started creating a whole ecosystem around the National Public Health Institute, the Nigeria Center for Disease Control, that was the hub in Nigeria. Whatever we're trying to do now, the hubs that exist all over the world right now are mostly located within National Public Health Institutes. All of that prepared us to some extent for the events that have happened in the last 2 years. The emergence of this new virus that has led to the biggest pandemic of our lifetimes, that we're all struggling to understand its implications, how to respond, how to continue responding in order to keep ourselves and the world safe. So this is really what has taken us to this stage. Through these few years, many new networks have emerged. In Africa, the Africa Center for Disease Control has grown from an idea to a really collaborating space created, bringing national public health institutes together for the first time to share knowledge, to share equipment, to share expertise, and to share leadership in terms of how to learn and move forward together collaboratively in our landscape. And you can see why all of this is important. Because as we have learned from this outbreak, and we have responded in our different ways in our different countries, north, south, east, west, we've started examining what has gone well and what hasn't gone well. And in almost every report and almost every interrogation of the response at local and national levels, one thing has come out, that we need better data, better ability to analyze existing data, better opportunities to connect data streams that exist, a better way of linking data from different sources and making sense of them in a way that we all collectively end up in a better place to respond to the threats that we all face and are facing. And that's really what has led the WHO to set up this new hub for pandemic and epidemic intelligence, launched by the DG of the WHO, together with the Chancellor of the Federal Republic of Germany on the 1st of September 2021, with the mandate to detect new threats of pandemic potential, to continue to monitor control measures in the inter-pandemic phase, and develop the tools critically to do so in a consistent way so that we're all talking and walking on the same page, and to leverage all the new developments happening in computing and technology, and try and see how we can leverage on those improvements in communication to enable a better space for us to do the work that we need to do to produce better data, better analytics, and hopefully all of this will lead to better decision making. And so the mission of our new hub is to build a system of collaborative intelligence, enabling better decisions to avert and manage pandemic and epidemic risks. This is a big challenge. I'm sure you're thinking, how would these guys sat in Berlin do all of that? How will you be Joyce in a few years' time in terms of your ability to deliver on this? But we're confident that we can, because we are not running away from the challenges that we know we face. Rather, we are embracing them. We're not pretending that the world is a simplistic place where things happen in a linear format from X to Y. No, we are recognizing the complexity of the world and actively embracing it. Saying, yes, we know that these things are difficult. We know they're complex, but that complexity cannot be a disincentive to engage. So we have to engage in this complexity. We have to engage with the uncertainty that are times, the uncertainty that is usual in the ecosystem at the moment. We have to agree that the learning systems that can evolve as we develop through this uncertainty, through this complexity, we learn. And every day we will improve the systems, because we recognize at the beginning that they will be blunt and there will be many mistakes made. And those mistakes hopefully will be opportunities to learn on how to do this better. But we can't allow this to happen organically and hope that somehow something will happen at the end. We have to convene the people, the resources, the institutions that will enable this to happen. And that's why we hope to create a collaborative space, not just a physical space, which we hope to create, but a collaborative mindset in how we want to work together. We want to build tools for collaboration to enable this collaboration to happen. Look at what the incentives are and disincentives, and engage with those incentives and disincentives in order to bring people and institutions closer together. We want to build adaptive systems that will focus on complex problems, learn from them, and keep improving on their own. So as we move forward, embracing this complexity, leveraging solutions in the different spaces that they exist, this will happen in different spheres. Recently, the one that's on the news the most is around the sequencing of virus strains, and we have seen what has happened over the last few days. But we mustn't take away the focus from the key problem, that the primary problem at the moment is still that many countries are struggling to build up their capacity to sequence in the first place. But once we develop their capacity, build up the human resources, the lab side, the analytics side, the bioinformatics, then we look at what are the incentives and disincentives for sharing. And we hope that as we develop this, it will be a lot easier for our leaders to take more rational decisions in terms of the benefits of sharing that we've seen has happened across the world over the last few days. But very often we are blind to many other critical parts of the ecosystem. This virus that we're facing did not evolve from nowhere. It came most likely out of an animal. And we have, as most viruses have over the last few years that have emerged, most of them have been zoonoses. Yet we're not doing as much as we can with the resources that we have already to monitor viruses in the animal world. So how can we engage in a really, truly One Health concept to face these challenges that we face, to confront the challenges that we face? There's never been a time in humanity that public health officials have felt so unable to convince people to do what we think is best for themselves. Even with the availability of vaccines in most of the countries in the global north, almost every country is struggling with uptake, with people accepting that these are life-saving interventions. So we have to understand better what drives human behavior, what drives movement, what drives how people decide on what to do. And these are new and evolving areas of science that all need to interconnect to enable us be in a better place to understand risk, understand vulnerability, and therefore define better ways of intervening. So what will be the features of the things that we will be doing in the hub, what we've described as collaborative intelligence? We really want to create a multidisciplinary opportunity for collaboration. And that's why everyone listening to this talk today is welcome to join us in our thinking and to think yourselves in terms of how we can truly work together and go beyond the narrative that we often offer of intending to work together to actually doing it. We want to engage a series of stakeholders and get out of our professional bubbles and invite others into our space and ask them to invite us into theirs. Because we recognize that unless we get the intersections of our work, where animal health meets human health, where the environment meets behavioral science, where social science meets genomics, until we can find those intersections and how to engage with them better, do we have a chance of confronting the big challenges ahead of us? To do all of this, we need to create a new trust architecture to enable us share our knowledge, because the default positions in which we have been socialized for hundreds of years is to hold on to the science that we develop, publish it, own it, and not share in an open space. There have been many attempts to confront this, so we're not going to reinvent the wheel, but whether it's about the use of technology, of open source technology, of academic work, we have to find a way to create an environment where we can share these for our collective benefit. All of this will be underpinned by institutions and networks looking for solutions. So we're not really going to create all of this from scratch. We know they exist already. There are lots of initiatives working on all the problems that we are stating today that are critical. None of this will be new. What we hope to do is to be able to convene, create an environment to learn from each other and use this to improve our ability to confront one of the most existential challenges that we face, the pandemic that has taken over 5 million lives and counting. And remember, we all accept we have not counted all. Will definitely not be the last. So we hope that by the time the next one comes, that we will be in a much better place to be able to access the resources that we already know that we have. To do this, we need to move from competition to collaboration. Easier said than done, but this is an existential challenge of our lifetimes, and we cannot run from this. We need to recognize that as much as we want to build this collaborative platform in Berlin, all health challenges start locally. All outbreaks start with a cluster of cases in some village somewhere in the world. So if we don't at the same time build local health capacity, local health security capacity, local analytical capacity, then we will have no chance in creating this great new hub in Berlin. And to do all of that, we have to learn again to work together. And that's really why this conference holding today in the middle of this pandemic is so important. And I ask you to open up your thinking, to allow others like myself attend and vegetate through your conferences, share the knowledge you have, and really encourage you also to share with the rest of the world the opportunities that you bring to the table to change the narrative around the work that we have to do moving forward. So thank you very much for this opportunity of sharing our vision for the Hub. We're very much in its early days of creation, and we look forward to engaging with really everyone attending this or watching wherever you are to think of how we can pool our forces together to create a safer world and to make us safer from the threat of infectious diseases moving forward. So thank you very much.